Welcome, welcome, welcome. Thank you so much for joining us here this evening. We are delighted that you have chosen to attend, and we can't wait to interact and hear your questions and get your feedback. This evening, we're here with Fulton County and Alive and in Color to discuss the COVID gap and the reasons for it. We're going to talk about how sometimes there's some fear involved in why people aren't getting the vaccine, and how in our community we can overcome that through conversation and through surrounding and helping one another. Before we really get going, we'll do a little bit of housekeeping. So the webinar is best viewed in speaker view. So you're going to want to go to your Zoom up there in the corner, and if you put it on speaker view, that's going to give you the best view. Also, if you have not done so at this point, please, please, please register at aliveandincolor.com. And if you have a question, if you want to engage, please feel free to put your question or comment in the chat, and we will get it to the correct panelists. It's fine to specify, or we can just ask the audience. We are happy to be here in partnership with several of our nonprofits that deal with our youth, community day camps, all these organizations who surround and protect the young people in our community. We know that young people trust them, and they have the best access, especially for some who may be difficult to reach. We have a fabulous group of panelists here. I'm your moderator. My name is Sarita Jackson, and I am an instructor at Georgia State University in the Department of Early Childhood, and I am a 5th grade teacher in Clayton County. So young people are my passion, and I am thrilled to be able to talk here with others who can help us help them. We're going to have each panelist spend about 30 seconds and introduce themselves. Dr. Armstrong, would you go first?
Oh, gladly. Hello, everybody. I am Mike Armstrong. I am the Chief Operations Officer for the Georgia Campaign for Adolescent Power and Potential, known as GCAP around town. Happy to be here.
Thanks so much. Next, we have Jeff Street. Mr. Street, would you introduce yourself?
Good evening, everyone. I'm Jeff Street, the Chief Operating Officer at Usher's New Look, also called UNL. Happy to be here with some of my comrades, Aisha, Michael. We've spent many a day trying to theorize around how we can, solve some of these community issues. So it's great to be with you all again.
Thank you so much. And Dr. Emmergluck.
Thank you. I'm Lily Emmergluck, and I'm a pediatrician in infectious disease specialist working here at Morehouse School of Medicine. I also am the principal investigator for our site's participation in the U.S. COVID Prevention Network, and also part of Georgia SEAL, which is a state-based collaborative organization that's been working with NIH to combat disparities related to COVID-19.
Thank you very much, Dr. Emmergluck. We can't wait to pick your brain. And Miss Aisha Williams?
Yes, my name is Aisha Williams, and I'm the program manager for the Westside Connect Community Health Worker Program at Chris 180. And I'm happy to be here tonight. Thank you.
And Miss Jessica Corbett.
Thank you so much. Good evening, everyone. My name is Jessica Corbett, and I'm the Director of External Affairs for Fulton County. And I've been working with the team that is doing vaccination, outreach, and education, along with our colleagues in the Fulton County Board of Health and the Emergency Management Agency. So thanks to all of you for your support and for being here tonight.
Ms. Corbett, was there anyone else you want to introduce?
At this time, there is not, but I wanted to acknowledge that some members of our Board of Commissioners may be joining us tonight, and I hope that I can welcome them as well when they're here. Thank you.
Yeah, feel free to just jump in when they arrive. We are going to begin by talking about how we're working to close the COVID gap in Fulton County. We are live, we're in color, and these are important issues that we need to discuss. Of course, we know that Black and Brown people are affected by health disparities, issues with access to health care, so that this virus has really hit our community the hardest. But when we start talking about the COVID gap, we're talking about how it's disproportionate. It's not an even thing. So Black and Brown people, Latinx, we've had more impact on our communities. We've lost more people in death. We've had more instances of the virus itself. Some of that is due to people not being aware the vaccine and how life-saving it is. Sometimes people don't have access. They're not sure where to go get it. They're not sure what it costs. And then, of course, then we have some people who just really can't accept that it works as well as we know that it does. We're hoping that through this conversation, we can really put our minds around how we can change some health outcomes for the young people in our community, how to deal with the economic hardships created by the vaccine, to just kind of get into the real issues. The same communities that were most likely to experience economic hardship because of the virus are also those same individuals who were hit hardest by the virus itself. So it's kind of like a double whammy. The hospitalization due to COVID-19, and even, of course, more deaths due to the virus. It's almost like you could say that having brown skin is a precondition for the virus. It almost makes you more susceptible just because of it. Dr. Emmergluck, I know that a large part of your focus has been reaching out to these most vulnerable communities of color. So can you help us kind of understand why Hispanics are more than 2.5 times more likely, and Black Americans are 2 times more likely to die from COVID?
So I, first of all, thank you for the opportunity to speak to this group. It's a real privilege to be here. And I think that question, we have to look at some of the socioeconomic factors. I like to think about some of the risks in terms of look who's getting sick. It's tied to severity of disease, to if people have predisposing conditions. So if they have health risk factors, which sets them back, then their ability to fight off an infection is going to be hindered. The other thing is just logistics. If you live in crowded housing, your ability to socially distance is going to be hindered. If you have, if many of our Black and brown folks live in, work as essential frontline workers, and so that risk goes up. So you couple all of these things together, and that is partly the explanation behind why we see so many Latinx and African Americans affected by COVID-19.
Thank you. Okay, so if I'm understanding this correctly, Ms. Corbett, can you help me? It seems that the communities that have more cases of the virus who are experiencing death from the virus more than others, and who are most impacted economically, these are the same communities where the vaccination rates are lower. Is that what we're seeing in Fulton County? Can you kind of talk about us?
Yes, thank you for that question. On the Georgia vaccine dashboard, you can drill down to the census tract level and see the rates of vaccination. And there is a high rate of correlation between low vaccination and high rate of the CDC Social Vulnerability Index. And we do see that in communities of color across Fulton County, our vaccination rates are lower, and there are other factors as well. But that is that closing that equity gap is really becoming central to the focus of Fulton County's vaccination efforts. And we are, again, very interested in any tool, every conversation we can have to help address that.
Thank you so much. Yeah, so the numbers don't lie. It's kind of obvious when we look here at the chart. Now, I have heard a lot about herd immunity. So I'm kind of wondering how that impacts the conversation here locally. First of all, I know a lot of people aren't even really sure what herd immunity is, how it could impact or even eliminate the virus. Dr. Emmergluck, can you kind of help us with the concept of herd immunity?
Yes. So as a pediatrician and having spent over 2 decades vaccinating children anywhere from infants to young adults, this concept of herd immunity is really important because we see it in our school systems, in our daycare centers. But essentially what it means is if you have a population of people who are at risk to get the disease or the infection, and then you have a vaccine, or if they get the disease naturally, then they have antibodies to protect them, right? So if you have a critical mass number of people who actually are either vaccinated and so they've developed immunity, or they had natural disease and they've developed immunity, then the people who are not vaccinated, or did not get natural disease, that risk for those folks go down because nobody around them actually has disease. So I extend that to the COVID-19 situation in the sense that, we have heard through so many different media sound bites about what that herd immunity looks like. And in general, we like to say that if we can get in any community around 70% or above, then for people who either got vaccinated or have immunity because they contracted COVID and still have that immunity, then the folks around them that aren't vaccinated may be protected. But you could see that the numbers were far from at that point to reach that 70%. And so whether, I'm encouraging, especially groups that think that it won't matter if they get disease or if they don't get the vaccine, it does matter. So when we vaccinate, you're vaccinating to help yourself, you're vaccinating to help your household, you're vaccinating to help your community.
So Dr. Immergluck, I've heard like some people who are hesitant themselves to get the vaccine, they will say, well, why can't we just get to herd immunity naturally? Can you kind of help us understand that? So,
the thing about SARS-CoV-2, the virus that causes COVID-19, is that it's a novel. Our humans hadn't seen it before this pandemic started. So the spectrum of disease goes anywhere from asymptomatic people who, don't even realize they had it, to people who have devastating illness and die. Now we see more and more about people who survive it, and then they have longer term consequences, or better known as long haul syndrome. I say this to say that we don't know who is going to respond in what way. So if you're going to rely that, it's like rolling the dice, you're going to rely that natural immunity, you just go in and counter it, and you might fall into the asymptomatic group. Well, I would discourage you from doing that, because not only are you thinking about yourself, your disease outcome also affects people that are closest to you, because you don't know how they will respond to an infection caused by SARS-CoV-2. So I have been at the, I know many people who actually have died from COVID, and the stories that came out of the early phase of the pandemic saying they're just people who have high risk factors, or they have, they're elderly, or that's not the case anymore. And so I encourage people to pause and think about that.
It's interesting that you said that that's not the case anymore, because another thing that I hear a lot is, well, we're not sure that the vaccines will protect us against all these mutations. And if we have the vaccine, why do we have all these mutations? How is that? Because I know more young people are now falling ill from this virus than did previously.
Yes. So let me just back up a little bit and explain about coronaviruses in general. Coronaviruses, which is the fundamental virus for which we see SARS-CoV-2, we know that coronaviruses in general, they are going to mutate. And not the novel coronavirus, but coronaviruses have been around sometimes, so we have some fundamental understanding about how they behave. So these mutants or these variants that have come up, they have different changes in the way let's say the spike protein is made on that virus. The more that we allow the virus to circulate in high enough numbers, the more that we have the risk of developing variants. We know now from the vaccines that are out and available through FDA and have received emergency use authorization for us to use in a pandemic, we know that they have performed well against many of these variants. For example, the majority of the variants now circulating in many of our communities is the UK, or now known as the Alpha variant. And so we know that the FDA approved vaccines that are available to us does protect us. And so I think people should think about that. And if we really want to drive down these variants, the way to do it is to increase the rates of vaccinations in your community.
Thank you so much, Dr. Emma Gluck. I think we have a better understanding of why the medical necessity exists. But Aisha, we've been talking about how this disproportionately affects Black and Brown communities, but what do you think are some of the reasons for this inequity?
Yeah, so I think that there's several reasons for why we're seeing disproportionate numbers among Latinx and African American communities. And while there were many mass vaccination sites located throughout the city, many individuals within those communities were unable to easily travel to those sites due to either disabilities, work schedules, or lack of transportation. And moreover, obtaining appointments for those appointments required internet access, phone access. It required, just a certain level of health and technical literacy. And also being comfortable online with registration platforms. That was very new to a lot of people. And so I think that, that definitely had an impact, especially on the community that I serve, just being able to have access transportation wise and technology access to schedule appointments impacted individuals' ability to access vaccines.
Yeah, I remember when the vaccinations first became available, I was part of a volunteer group where we kind of tried to help people find appointments nearby and, make sure they had whatever paperwork they needed. So definitely, access, ability to, even get to access to the access.
Exactly. And even if you were tech savvy, and you still had, people still had a difficult time, finding those appointments. Oftentimes they were gone within minutes. And so, that's, somewhat delayed maybe people getting vaccinated, and it may have deterred them altogether. So, that's one factor. And I think too, while marketing campaigns were, plentiful, I think that some of those efforts, like you mentioned with the volunteer activities and the local vaccine sites, some people just weren't aware. So I think that, as we continue to move forward with doing the vaccinations, increasing marketing and increasing awareness within the community is going to be critical to getting those vaccines out to the right people.
And Ms. Corbett, I know that you will have your finger kind of on the pulse of what's going on when it comes to closing that equity gap in Fulton County, and especially in our at-risk communities. So can you tell us more about what the county is doing specifically in these most vulnerable communities?
Thank you for asking that. There is a lot of work happening right now in terms of outreach. We've really identified a few areas. One is education. I've heard several people mention that. One, in just making sure people are aware of the benefits of the vaccine, the fact that it is available for young people 12 and up, and really, again, honing in on some of the reasons that people have given not to be vaccinated. The wait and see is a common one. And we really encourage young people, especially people who are going to be attending school in person in the fall, we encourage them to be fully vaccinated by the time school starts. So that kind of education. Town meetings like this, sessions like this, and providing information. Another outcome of tonight's session will be a conversation guide that the Black Cross will be producing to help youth leaders really have those conversations with the families they know and work with. We are also looking at incentive programs, and that could be things like giveaways. It can be things like we are looking into things like activations and concerts, and just anything we can, any resource we have available to get that information out. And we've talked about obviously race and geography are two areas where we know we have gaps, but the youth gap is part of our effort to really create equity throughout Fulton County and help us get to a better place as a community.
Thank you so much for bringing up that Black Cross conversation guide, because one of the things I'm interested in is how is it that youth organizations, educators, those people who kind of have their hands on the young people, how can we help decrease that equity gap and increase access and awareness to the vaccine?
Well, I think that's exactly, and I would love to hear the other from the others on the panel tonight. But you know, in my life, I'm a parent of a 17-year-old and a 12-year-old, and they're teachers, that leaders of organizations they're active in, youth pastors. People like that are very influential in the lives of parents and families that I know. And I believe that's true across the community. So really preparing anyone who works with young people and cares about young people to talk about the impact not only to their health, but to their mental well-being, the fact that they don't have to necessarily, for example, quarantine once they've been vaccinated in the same way if they're asymptomatic. Just there's so many benefits to vaccination and helping people answer the questions they may have about risk and about both about the risk and benefit. And I would say, but again, I think that others who are in those leadership roles could probably answer that.
So yeah, let's open it up to the other panelists. What do you think? What can we do as those who work with children on a daily basis, whether it be at the Y or the Boys and Girls Club in the classroom? How can we kind of help propel the movement?
So we are involved in a study that's actually sponsored by the National Institutes of Health. And we were looking at 18 to 29-year-olds as far as to understand ideas about why they might have vaccine hesitancy or just they just don't care. And we developed a youth advisory board. And the youth advisory board was actually, originally it was formed by students who are part of our Atlanta University Consortium, which includes Morehouse College, Spelman, Clark Atlanta, and Morehouse School of Medicine. And we wanted to hear from them to then they can like talk to their peers to understand, because I think that vaccine hesitancy isn't like one shoe fits all. I think there are reasons behind vaccine hesitancy, and it's being able to listen to your community and listen to the folks and ask them, who's your trusted source? Because I think to drill down to that way and use that community-based approach, that's probably a tactic that might be able to address very specific concerns that you can't just assign and say, you know, vaccinations are good for us, it protects all of us.
Jeff, what are your thoughts? How do we help the young people help themselves?
Well, you know, I think that it's largely about educating and empowering young people to be change makers. That's a big piece of our work at New Look. Our mission is really rooted in developing passion-driven global leaders through a couple of different ways. One of our important pillars in our programming is service. So if you look at movements, historically, young people have been at the forefront. They're the people who usually drive change. So I think this is no different. It's trying to find ways to activate young people in efforts to make change. You know, we're living through unprecedented times. You know, it's difficult enough to be a young person as you're trying to figure your life out and, you know, what your next steps will be as you try to grow into adulthood. But, you know, imagine having to do that through a global pandemic. I mean, it's unreal. So for us, you know, we wanted to do something to be responsive and to figure out ways to support our young people to become those change makers that we know we need. So what we did was we partnered with a world-renowned health institution in Johns Hopkins Hospital in Baltimore and held a series of virtual sessions on COVID, but just discussing all different types of topics related to COVID. So understanding the biology of COVID and how it functions, understanding, you know, preventive strategies to help stop the spread. We taught them techniques to use materials in their home to make their own hand sanitizer and face masks from t-shirts. So just thinking of different innovative ways to engage young people in this struggle, because, you know, and Jessica and Fran's not on here, but this conversation largely mirrors the conversations we had in 2020 around the census and voter engagement, right? It's trying to figure out how do you develop these trusted voices to activate people in the community and who people in the community can trust to give them quality information. I mean, you just think about the droves of misinformation that's out there, right? You know, it's very difficult as an adult to figure out what's true. You know, science is always changing. So again, imagine being a young person and trying to navigate this. So I think it's really incumbent on us to find ways to support them, to help develop their knowledge base and the confidence to speak intelligently about how we can all stay safe.
I'm so glad you actually brought up the movements around the census and the vote. One of the things we did in Clayton County with our seniors, junior seniors who were turning 18, was we helped get them registered. When it came time to vote, we put them on school buses. We took them to their local polling places. I guess with the vaccine, it just seems, you know, people are always touchy when it comes to health. And so we kind of feel more at a loss as to how to help than with a social action. You also talked about, Jeff, how this is about not, or was it Ms. Corbett? I'm confused. It's not just about access and awareness, but some of it is about behavior, right? So it's attitudes that they have that are based on real life, right? This is not just pie in the sky, unrealistic fear. So how do we kind of deal with those attitudes and those behaviors, especially as it relates to, you know, mitigating the risk to young people from this virus? Okay, let's just talk a little bit more about that then. So one of the big things I heard, especially when the virus in Georgia opened up to all people, you know, all adults, there was a lot of, you can't trust it. No, they'll never do us right. You know, that kind of conversation and fear. And of course, you know, we know that those concerns are based in how African Americans and Latinx people have been treated when it comes to healthcare. So I know we have to acknowledge that this stuff is reason. Black folk ain't crazy. There are valid reasons for fear. We think back about Tuskegee. And just for common knowledge, we had Black men who were told that they were being treated for syphilis when in fact they were not being treated. And this thing went on for 40 years. So in fact, I want to say that the last gentleman who was a part of the study just died in like 2004. This is not distant history. So, you know, we have a lot of people who have personal knowledge of these events. And so they're reasonably skeptical of what's going on. And we think about penicillin was available. It wasn't like there wasn't a treatment, which is kind of like the vaccine, right? There is a treatment. There's a way not to get it. But getting that trust for the medical community is something of a challenge. And, you know, of course, Tuskegee wasn't the only thing. You have the forced sterilization of African-American women, especially in the South, you know, and this, again, went on for long periods of time. And even today, we know that studies show that there's persistent bias in medicine in the way that Black and Latinx communities are treated by healthcare professionals. So these are some of the fears, the concerns that people have. But the question is, how do we get over that? How do we encourage and get beyond it? So, Dr. Emmergluck, what do you think? How do we deal with these well-founded doubts, these reasonable doubts that people have?
First of all, I think, like you said, it's important to acknowledge these really injustices and just the misconduct in doing clinical research that had happened. But, you know, the president of Meharry, I was on a town hall with him, and he mentioned, and he stated, you know, from those injustices and abuse have come out regulatory bodies, and we govern every aspect of clinical research now by these policies and guidelines that have developed out of that. and including, so there's ethics committee for every research project that we conduct here at Morehouse School of Medicine. So being a part of a vaccine trial, for example, we are governed by a kind of centralized IRB that's like a more national or international, in fact, body. But then we at Morehouse School of Medicine have our individual ethics board made up of physicians, scientists, lay community members to evaluate each project for the ethical concerns that might exist that we need to face. But the other thing, if you listen to, so we just, we just completed our enrollment of, or not enrollment, but the Novavax vaccine trial at Morehouse, and we have about 60% African Americans in that trial. And if you listen to the reasons why these folks have stepped up and come to volunteer to serve as a study participant to the vaccine trial, I've been totally humbled by this, each and every one of their stories. But it is for the greater good of saying, you know what, we acknowledge these things that have happened, but we also believe it's important for African Americans to be represented in these vaccine trials. If we're going to want to know how well they perform in terms of keeping us safe and not die from COVID, then we need to make sure that Black and Brown people are represented in these trials. So I say that to say that I hope that history has taught us a lesson that we move forward and we say, how can we keep ourselves safe? And I think these vaccines have proven that.
Yeah, it's a biggie, but like you said, acknowledging it that this is real, but trying to, through conversation and community, move past it. But really, when we focus on the young world, we know that the numbers for the adult population differ vastly from the numbers of youth. There was a Kaiser Family Foundation study monitor, and it said that 18 to 29-year-olds are less likely to have been vaccinated, and they're also less likely to have a plan to intend to be vaccinated. There were 24% of them who fell into that kind of let's wait and see group that we talked about earlier. And then another surprise for me when I looked at this was that one of the motivating factors was that their friends aren't doing it. So we know peer pressure can be negative, but this is more like a lack of positive peer pressure. So either, the people around them aren't being vaccinated, they're not willing to share that they have been vaccinated. It's just a whole, I guess, kind of a different group of outside pressures that young people are experiencing. Now, there have been some ideas, like Ms. Corbett was saying, that Fulton County is considering around how do we encourage, how do we motivate them? How do we move them away from waiting to see to vaccinated? And we know that other states and cities are doing some things that people might even consider outlandish. But the research says that if we require vaccines for travel, young people have, my daddy used to call it the go-go's. They're moving around, they're going places. So 40% of young people said that if it was required to get on an airplane, they would do it. That's a significant increase from the 24% we're at now. Another one of the things that they mentioned was entertainment. So if you had to be vaccinated in order to go to a Braves game, see a concert, then 39% said they would get vaccinated. And one of the interesting things was, I call it the convenience factor. 38% of young people said that they would get vaccinated if only one dose was needed. So we know that there is a one-dose vaccine. So there's obviously a disconnect there somewhere. Aisha, what do you think might be some of that disconnect?
Well, I think that, for a lot of adolescents, and particularly the ones that we serve, we have a unique population. And the 18 to 24-year-olds that we serve, a lot of them are homeless. And so they're actually focusing on seeking out those basic needs. They're looking for food, shelter, employment, and income. And, you know, some of the kids, they're just figuring out how to finish school. They might be trying to get to college. And so I think for a lot of people in that age group, unfortunately, getting the vaccine is not a priority for them, unless you said some of those other motivating factors like entertainment or travel. So I think the main challenge is just how do we, you know, make it appear as more of a priority or make it more of a priority for them. But you know, for a lot of people, I think that they are just trying to meet those basic needs right now. And, you know, just a lot of people are impacted with, you know, rent and needing rent assistance. And so I think it's a challenge when people are dealing with those other basic needs. You know, the vaccine sometimes tends to take a back seat. And also just the social media is a huge influence for young people. So I think there are so many different memes out there about, you know, how the vaccine can make you sick. And, you know, so there's so much misinformation among young people that, you know, we definitely have to kind of gear them to reputable information and sources and flyers and videos that are really relatable to them. So videos that include young people that are relatable. And, you know, even if it's different entertainers or people that are social influencers that we can work with to help reach that young group. But I think just between some of the personal challenges that they're having and needing to meet their basic needs and the social media misinformation that they get, there's a lot of different factors working against us getting that population vaccinated.
Dr. Hines, who's in our audience, is a pediatrician, and he work. I'm not sure she or he, but their work is with, you know, patients who range in age from, you know, newborn to 21, and so several of the patients have commented that that they're getting vaccinated because their colleges, the HBCUs in the metro area especially, are requiring it. So the question was, what do you guys think about that? What is there a plan for required vaccinations when it comes to, you know, colleges and universities, especially private colleges and universities? Would that move the needle?
I think so. I mean, I was thinking about how to answer that, and to me, you know, it's education is empowering, and you have to always think about how to do that, because I think empowering people, no matter what age, what race, what ethnicity, is important. And but I do think incentivizing or mandating it, especially for young adults, is needed. I mean, I think that, I mean, Morehouse School of Medicine, we are mandating it. And that's everybody, students, staff, faculty, everybody. And the AUC consortium also likewise. And so I've talked with students, and at the medical school, they, you know, most of the students are vaccinated, but in listening to their peers and why they don't kind of like join in on that, it's not a priority for them. If it's inconvenient in any way, then they're not going to bother necessarily going to get it. But that's where I think, you know, schools and other institutions have to make it very convenient. And we try to do a lot of different things, even early on when we were in the priority groups, by vaccinating in our parking deck. You know, we turned our parking deck into vaccination. We took our mobile unit out to vaccinate. We have to get to the population and not make the population get to us.
In my role at Georgia State, I work in teacher preparation, and it was a big push when vaccines became available to get educators vaccinated. And I know that for some of our teacher candidates, they were kind of in a gray area, whether or not they were considered teachers in order to get vaccinated. So I know that was a cause of some hesitancy, but the majority were vaccinated, and those who chose not to be vaccinated haven't really felt comfortable sharing their reasons. And so I think that that's definitely, you know, another thing with, you know, HIPAA and all the privacy concerns, that requiring it becomes becomes challenging for some institutions. Dr. Emmergluck, I know you talked about how you work with the vaccine trials at Morehouse. Can you comment any more though about the other barriers to accepting the vaccine that may be out there?
Yeah, I think the number one barrier is concern about the safety. And I know we're going to talk later on about the concern about how do we get to these vaccine so quickly when this pandemic has only, has been here for a little over a year. So I can wait till we get to that slide. But in general, I think safety has been the biggest concern. And then that pivots with the new vaccine. Are we rushing through things? But I would say to folks who have that concern, now we have millions upon millions of people who have been vaccinated, and we have a system as a country that goes all the way down to the county level where we monitor for safety. So for example, when I stood in line to get my Pfizer vaccine, at the Children's Hospital, I literally registered onto the V-Safe program. And I every time I get a prompt, I still respond because I feel like I'm contributing to the safety data. Same with our vaccine trial participants that are in our Novavax trial. They're in it for 2 years. They literally, we monitor them very closely, and we assess them for when they suspect they might have COVID. We test them, and try to make it very convenient for them. And so I think we should be allayed by that, because now at this point we've had, almost half maybe slightly over half the country's had at least one dose. So I think from a safety standpoint, people should be reassured by that.
Yeah. Can we have the youth study slide? While that happens, Dr. Armstrong, I'm curious to know if, or just how this conversation so far aligns or measures up to what you're seeing with your work at Georgia Campaign for Adolescent Power and Potential. What does hesitancy look like among the adolescents that you serve?
Well, I will say the themes that have been spoken so far are resonative. They do resonate with what we've heard from our youth. But what I haven't heard is speaking about the youth who have been vaccinated. For the youth that we serve directly at GCAP, about half of them are vaccinated. And they are extremely supportive of vaccination, so much so that they want to be advocates and champions to convince their peers to do so. But there is no middle ground there. There's either, we have youth who are extremely supportive and excited, and we are those who are skeptical. And the ones who are skeptical and hesitant, they've spoken to the same thing we've already heard about trust. And yes, there is some trust in the message around the safety and efficacy of the vaccine, but really the overwhelming theme coming from the youth that we serve is that there's a lack of trust in the messenger. And when I say messenger, I'm talking about two different entities. I'm talking about the government, and I'm talking about adults. And we've spoken around this already, and I'll say a little bit more about it. There's very little about American politics in recent days that gives anybody trust, especially our younger generations who have known nothing but a highly polarized, ineffective government. And as they come to realize and recognize the role of government in perpetuating structural racism and our past atrocities, they're just not going to trust the government. And we have to think about who is it that's running the government, who's running schools, and who's really running every aspect of the life of our youth. It's adults. Adults who, for the most part, struggle with communicating with youth, either in their same language or in the medium in which they try to communicate. It's many adults who honestly still struggle with the trauma of their own lives to be even able to genuinely connect and support and communicate with young people.
Yeah, that's a valid point that, when they look at the leadership there.
And when we're able to do so, we often do. So I would say that even beyond COVID, adults who work with youth, we have got to do a better job at supporting and communicating. Getting an unstable connection here. And when I say we support and communicate them, that communication has to involve speaking their language, using the right communication channels, and quite frankly, a lot more listening and a lot less talking. So the way GCAP overcomes these barriers is that we rely on one of our most effective strategies, which you heard Jeff talk about a little bit, and that's grounded in youth empowerment. We train our youth to not only be consumers of health information, but we empower them to be advocates and agents of change in their communities. So what has worked for us when it comes to any matter of health or well-being has been to equip them and train them in advocacy. And we have a youth advisory board made up of 40 youth from across the entire state of Georgia. And they have taken it upon themselves to develop short video clips to promote and empower their peers to receive the vaccine. And we're not going to broadcast these video clips attached to an email. We're not going to broadcast them on the evening news, but they are going to broadcast themselves across their own networks, and GCAP will do the same. So what they will hear, they being youth that we don't reach, will be messages coming from their colleagues, from their peers. When a trusted adult is not available to relay the message, it's best heard and relayed by other young people.
Yes, that positive peer pressure we were talking about.
Yeah.
Sounds a great idea. Jeff, what do you think? What does hesitancy look like among the adolescents that you serve?
I have to say, Mike, you should just drop the mic. I mean, you just dropped a bunch of jewels on us. It was amazing. Michael hit on a couple of points. I mean, he talked about trust. He talked about communication. Talked about listening and youth empowerment, and that's our approach as well. I can't really speak to acceptance rates per se. Our programming touches. We have a focus in Atlanta and New York, but also a national and international presence. So it's difficult to say what acceptance rates look like. But a lot of the conversations we've had with young people revolve around many of the topics that Michael highlighted. And I think that this wealth of misinformation makes it a very difficult process to navigate. And as such, it kind of keeps people on the fence, right? So our aim is really about building up that confidence to become trusted voices. Aisha talked about that. Dr. Immergluck talked about the importance of trusted voices and empowering them in that process. But I want to go back for a second, if we could, and kind of talk about the equity issue here. And I hope I'm not getting too far ahead of your conversation.
Go for it.
I think when we talk about, what's the greater challenge, is it vaccine access or is it vaccine acceptance? It's really difficult to say. I mean, they're both equity issues, but, from my vantage point, I think the inequities that we're seeing in both areas, they stem from systemic racism, right? And you also put other key factors at play, such as the historical atrocities committed on Black, Indigenous, and people of color. You talked about the Tuskegee experiment, and while it's not the same, it resonates so much with us that it helps breed that distrust, right? And people have not really acknowledged how it happened, the why behind it, and what steps were taken to correct said behavior. So Dr. Immergluck, I applaud you for the measures you all are taking to make sure that studies are done with integrity. But I would challenge healthcare professionals that are in that work to develop messaging for common folks that's readily accessible through media outlets and other places, so that people can be more informed about the corrections that are happening and not have to rely on extensive research. And that's just not everyone's thing. It's not right or wrong. But Aisha, you talked about even with internet access and registering for vaccinations, and you put the digital divide into that, and it makes things even more complicated. So we have to figure out ways to kind of reimagine and refocus ourselves on messaging, so we can kind of help change things. But so I talked about systemic racism and inequities. This misinformation is out there about the virus. Like, there's so much out there that's conflicting about how it's contracted, how it functions, what safety measures actually work. We've had this weird conversation around, do masks work, right? And all of those serve as distractions and make it even more confusing. And then you throw on top of that propaganda and misinformation about vaccinations. So, you put all that in a pot and you've just got a bunch of confusion. Again, Jessica, it's just like the census work, it's just like the voter work. So, I think that so much energy was placed on, equity in terms of making sure folks from these backgrounds or these communities that have been historically excluded get this quality information to help them change behaviors, but not enough emphasis has been placed on how do you effectively combat those same folks' concerns about the virus, as well as their concerns about vaccinations. I mean, those two things just by themselves, that's a huge task to tackle. You know, so again, I hate to beat a dead horse, but just like in census and voter outreach or mobilization, you know, the change in attitudes don't just happen because you share information. It's way more complex than that. You know, it has everything to do with that trust word. And thank you, Michael, for naming it. Trust is what we are really, it's at the root of the change that we need to see. You know, you can't just show up on the scene and drop literature on people and quote studies and research and think that that's going to change their behaviors. For some it may, but research shows that that hasn't been the most effective way to get people to accept vaccines and things along those lines. You know, people have to trust you. You know, they have to feel like they're not being exploited or taken advantage of, because for so long and, you know, so many times and for so many years, you know, folks from these demographics and communities have been victimized, right? And it continues to happen. So, you know, how do you change that? You've got to build trust, you know, and on a certain level, I have to say, I definitely get the resistance to taking some of the actions that government officials and CDC officials and other medical professionals have put out there to the public. You know, it's a protective mechanism. You know, if I don't have that trust, my default is to not act or act in the opposite way. So again, I mean, it's really important for us to reimagine and refine our approach to these outreach efforts. And last thing is, you know, I read an article that was published by the World Health Organization that really talked a lot about this subject. And that research again showed that it's not just giving information to people that really moves the needle. It's really about, you know, building that trust, overcoming some of the social influences and getting people motivated that really, you know, in conjunction with the information that moves the needle. So when we talk about, you know, developing an enabling environment, you all touched on this too, you know, making vaccines easily accessible, making the process quick, making it cost effective so that those are not barriers for people who experience those as challenges. You know, we talked about the trusted voices and getting people that are celebrities or respected in communities to show themselves getting vaccinated and talking about the why, or even talking about, you know, some of their challenges that they faced in terms of getting vaccinated, so that it you know, that's approaching people like humans and saying that, you know, I have some of the same challenges or some of the same reservations you may have, but this is what helped me to make the decision to move forward. And then finally, you know, it's that trust has a lot to do with the motivation to change my behavior. And, you know, a lot of that is about confronting these myths and this misinformation through conversations like this, you know, getting people who are trusted voices that look like you, that come from your communities, to talk about the why behind science, you know, the science of fighting the spread of the vaccine, excuse me, the spread of the virus, or how vaccines work. Because we have so much out there that, you know, folks talk about your DNA changing and you know, it's just very difficult to navigate. So we have to have more of these conversations, and it's not a quick fix. You know, there is no silver bullet. It's going to take a lot of conversations and people coming together to really develop that bond that allows them to want to experience that mind shift.
Yeah, Jeff, I'm glad you talked about the misconceptions and the changing, you know, what we know about the virus and how it gets spread, all those various changes. I could definitely see how a young person, like Aisha said, I'm trying to graduate from high school, trying to have a roof over my head, I'm trying to get to this job, like it's too much. And so they disengage.
Hey, Sarita. Yes. Yeah, this is from the chat support. There is a question. As a pediatrician who works with patients up to 21 years old, I've had several patients get vaccinated because the HBCUs here in Atlanta are requiring it. Is there a move for any other schools or organizations to mandate the vaccine for participation?
So yeah, Dr. Emmergluck spoke earlier about how the coalition of HBCs that we have here in the city is requiring the vaccination, and how hopefully that will provide, more positive peer pressure, right? So every young person that gets vaccinated, now they have themselves as evidence to talk to the next young person. I do want to talk to the audience though. Audience, what are the 3 top areas of vaccine hesitancy that you see, that you hear from young people? We're going to put up a poll. It says, please select the top 3 areas of vaccine hesitancy you see among youth and young adults in your community. You can choose more than one. So speed of the clinical development process, concerns about safety, logistics. Where's the vaccine at? How do I get it? What will it cost? Can I get off work? And then of course the history of mistrust that we were just talking about, and that misinformation, the conspiracy theories. If somebody injecting a microchip into my arm, they want to track me. That was the funniest one to me. I'm like, dude, you carry your phone everywhere you go. If somebody wanted to track you, they don't need a microchip in your arm. But audience, if you would share with us what you think are those 3 top areas. Oh, panelists, please weigh in as well.
I just want to say I appreciated Mr. Street's information. I just also wanted to add the complexity is that because this is a novel coronavirus, the information is changing. And so that's a little unsettling. That adds to the fear and the anxiety because the science, and as we understand it, starts to change. And so that messaging has to keep up. And I think that's also, for scientists, that's unsettling. As a physician, it's very unsettling too, because you want to be able to hang your hat on certain tenets about how to prevent or how to, facts about the virus, and that keeps changing.
And I too, just to add, I think that, like you mentioned, Greg, or Jeff, I'm sorry, Jeff, the messaging and the framing is so key. And I think that, there's an opportunity there to really focus more on how we frame the messaging. Because there was actually an article that I read about how Black and Brown people actually had more hesitancy when they saw marketing that was and messaging that was targeting Blacks in Latinx communities specifically. So when it was specifically targeting Blacks, saying, to come out and get vaccinated, that actually increased hesitancy because they were at, some people were, well, why are you targeting us? Why are you wanting Black people to get vaccinated? Why is the messaging not speaking to everyone? So I think we have to also take that into consideration when we're messaging and framing our message, that it needs that sometimes making it more inclusive might make it more effective, because when you do target a specific group, it kind of, because of all the mistrust, it kind of, I think, increased a lot of hesitancy because, you're just wondering, why are you targeting our population so much? So I know that was a concern among people as well.
So I don't know if you guys got a chance to see our poll results, but I found it interesting. First of all, most of them were pretty close, like a range of there you go, 75 to 81, except logistics. And that speaks to how well Fulton County and other various government organizations have done with making the vaccine available. And so there wasn't also as much concern around the speed of the development. So, the messaging to some degree is getting out there. But back to that issue about schools requiring the vaccine. Interestingly enough, so we have data that supports the fact that only 41% of parents say that they have had their adolescents, that 12 to 17, that newest age group who can be vaccinated. Only 41% of parents have had their adolescents vaccinated. And about 20% of parents are on the wait and see as far as their children are concerned. And 14% say that if schools require it, they'll do it. But that last piece of data, that 20% definitely will not. That's concerning. Ms. Corbett, what do you think about, is it likely that schools are going to require the vaccine for adolescents? Are we talking about that happening this school year?
So we have heard that so far private universities and some private schools are making that requirement. But at this time, public schools and universities are not. The vaccine, as I understand it, some of the vaccine providers have begun the application process for full FDA approval, which could potentially change some of that in the future. Of course, there's a lot of, I think others have talked about privacy and also kind of personal health choice. And there's a lot in the legal landscape that also has to be resolved. At Fulton County, of course, we are pro-vaccination. We believe that this is the best thing for our community to restore health. But in terms of compliance, those are things that are being worked out by a number of government agencies. Our focus right now is on improving access and outreach, and we're not at a compliance stage yet. But we know that this has been part of the national conversation that both employers, educational institutions, businesses are all looking into.
Aisha, what are you hearing when it comes to the parents that you encountered through your work at Chris 180 about their intentions as far as the children are concerned? Anything working to overcome some of the barriers?
Yeah, I think like as the dad suggests, there's definitely some parents that are vaccinated or are working to get their kids vaccinated. But I would say that there's a good portion too that are in that wait and see, as the data suggests. And of course, we definitely have some parents that have just expressed that they're not getting vaccinated at all. So I think for most people, they want more time to pass to see what the information says, that like Dr. Emma Gluck said, things are kind of changing rapidly. And so I think people are kind of wanting that additional time to see what more information comes out. And so the main thing that, I tell parents is that it's important to stay up to date, on the latest news about the vaccines and to make an informed decision. I think that's the most important thing, is just redirecting them back to those trusted resources, making sure that they're getting their information from fultoncounty.gov and from CDC and not, their aunt or their grandma or Facebook, so just making sure that they're getting their information from a trusted source. And two, I think, one of the parents I was having a conversation with today, just really, thinking about kids are going to be visiting grandparents. They may be staying with grandparents over the summer. They're going to be taking family vacations, going to summer camps, and, just letting them know, thinking about your other family members that they may be exposed to over the summer and over the rest, and coming for the holidays, for, Thanksgiving and the holidays coming up in the fall. So just thinking about getting kids vaccinated can help kids safely get back to doing the things that they love, but it also can help to protect family members that may be at greater risk of getting sick. So it's really, again, providing that information and just, kind of reiterating that, it is for the greater good of the community, but also, for your family as well.
Yeah, and hopefully that will motivate some people. Audience. Go ahead. I'm sorry.
Oh, I was just going to add that I also wanted to say that along that line of things changing, I think early in the pandemic, people were hearing the message that, this is a virus that only impacts the older folks, people with chronic conditions, people who are immune compromised. A year into this, we see that it's not the case. And if you look at any of the dashboards, including CDC, or even our county, you can see the age distribution of people who are affected by COVID-19 has shifted, so that we have our younger population to think about. In fact, I would say that the younger population, the rates of them per population, 100,000 of that population age group outpaced the older folks. The other thing I want to mention as a pediatrician again, is that people don't recognize, and maybe doesn't get the sound bites that other stuff around COVID do, but kids are dying from COVID-19. And so there is a syndrome that's unique, more impacting children than adults, and it's a multi-inflammatory condition, and it impacts their heart. The other issue is the toll on, in terms of the long haul syndrome, on the mental health and well-being of our children. I would say we need to, like, again, try to get the information in a way that is culturally sensitive, in a way that makes it real, so people recognize it can impact their households.
Yeah. Audience, I'm interested in, I know many of you are parents, and of course, parents talk to parents. I'm interested in what is it the parents in your community are saying when it comes to having their children vaccinated? Are they concerned about the speed of the development of the virus? Are they concerned about its safety for their children? About just the logistics around getting time off, get the kid to get to vaccination, get them back to school, that kinds of things? Is it that same hesitancy they have for themselves about that this may not be safe, especially for those of us in the Black community? Or is it that same misinformation and conspiracy? So what is it that, what do you hear as reasons why parents aren't having their children vaccinated? And those, I know some of you panelists have mentioned that you are parents as well. And so if you guys would weigh in, that'd be fabulous. Yeah, so the concerns about safety is overwhelmingly the issue among parents, and that's completely reasonable. And as we wrap up this section about parents, I'm curious if anybody has heard in your organizations or in the parents that you encounter, how their feelings are about that new age group that's available to the 12 to 17. Anybody heard any, are the feelings the same as it would be for other groups? Because as we mentioned, we know that next to roll out will be school-age children. And if we're only at 24% of young adults, then.
Yeah, I definitely think that, parents are more hesitant in that age group of 12 to 17. I think that, as a developmental stage for a lot of adolescents at that age and going through puberty and all of that. So I think that for some people, that I've talked to, there's definitely some increased hesitancy for that age group, given, just their developmental stage that they're currently in.
Audience, your feedback is so important and vital to this conversation. I'm curious that if the parents that if you yourself as a parent, if you were asked about your intentions as far as the vaccination, what do you think people would say? Would they say that their children are already vaccinated, that they're about to be vaccinated, like they've got plans to do it now? Are they on the wait and see boat? Or are they only going to be motivated by requirements? So speak for your community, speak for the other parents that you encounter, speak for yourself.
Now I can speak for some of my colleagues at Morehouse School of Medicine who have young children, that even though they're vaccinated, they're hesitant to unmask, even though, like, looking at the CDC interim guidance on this, partly because they don't want to put their children at risk, because even though we believe that that if you get vaccinated, your risk, if you get if you get exposed to the virus, that you're likely not to, number one, get sick from it, and number two, your shedding of it to infect somebody in your household also goes down, but it's not zero. And so I know that some of my colleagues are worried about not knowing who's not vaccinated, because now it's harder to tell when you go out to the grocery store or whatnot, because people may be vaccinated. That's why they're not masking, or they're not masking because they don't think it's going to happen to them. So I do want to mention that piece.
And again, the results from our poll show overwhelmingly what you just mentioned, Dr. Immergluck, that people are concerned about the side effects that we may not know yet, and they're choosing to wait and see. Panelists, as we begin to wrap up, you guys have done an amazing job of really helping to answer some of those questions that, as a community member myself, I'm not even sure who to ask. And there's really important information that we're providing. But I want to be sure that we wrap this up with actionable steps, with how is it that we can get to COVID-free communities? What is it that we can do to get kids vaccinated before they go back to school? As an educator, I can tell you that we need as little interruption to learning this school year as possible. There's all that conversation about learning loss and the gap, and what we really need is time on task. Kids at school doing the things, being active, not on the computers, doing what it takes to really acquire knowledge and information. And so we know that the majority of parents haven't yet vaccinated their kids, and we know that most of them are not willing to at this point. So we know some information about what's going to help people decide on vaccination. We saw that in our poll, the wait and see group was the largest. And so if you drill down into that, the 66% of parents who are in the wait and see group, they don't disagree that the viruses are effective at preventing hospitalization, severe illness, those kinds of things. So just that information alone can move the needle. So just kind of like Jeff talked about earlier, messaging. How do we get it out there in a way that's effective? 49% of that wait and see group says that if they knew more about the technology behind the virus, and they knew that it had been in the works for 20 years, that could potentially move the needle. And I thought the really interesting piece here was really my go-to when I talk to people who aren't vaccinated. It's the learning that the long-term, when we say, well, we may not know what's going to happen with the vaccine, but we know what's going to happen if you get COVID. So that is not a convincing way to go about it. So we know we got to change that messaging, and it's because it's not reaching out to young people or their parents. If people are interested in the science, right, knowing about the technology of the virus, we've got to find a way to simplify that so that people, we can put it in everyday language. I know doctors as scientists, you guys, sometimes you explain things, even in the one-on-one patient setting, and we're like, I'm not sure what you said. So if safety and effectiveness are a concern and they're asking for more information to increase the likelihood of them getting vaccinated, Dr. Emma, can you help us? Give us some wording, some messaging to help simplify the science.
Well, first of all, let me just say that I get asked that a lot in different communities. And I would say first and foremost is to reassure folks that there is no live virus being injected into them. And number two, I think of it as this way as far as talking about vaccines and how they work. I'll give you the idea about the bicycle. So the bicycle has many parts, got the pedals, got the chain and so on. And if you have a vaccine that targets making immunity against one part of that, let's say the handlebars, so that if you see the handlebar, you'll know to tackle the whole bicycle. And that's how I think about the COVID vaccines. All of them, whether you're talking about the mRNA, like Pfizer or Moderna, or you're talking about the Johnson & Johnson using a vector process, or our Novavax, we're all targeting that spike protein so that your body sees that one piece of that virus. And so if it encounters the real deal, the whole virus, it will know what to do because it already saw a piece of that. And that's what we're banking on. We're banking that our immune system recognizes that. And that's how the whole idea behind all these vaccines that, the ones that we give in childhood, hepatitis B and at newborn, the pertussis vaccine. And I'll say also look at history. When I give a lecture to the medical students about vaccines in children, I ask them, how many of you guys have seen a case of pertussis? How many of you have seen a case of tetanus? Many of them, almost all of them say none. And why is that? Because when I was a resident in their shoes, I took care of patients who had pertussis. I took care of patients who had pneumococcal. I had patients who died from that. And nowadays they're not seeing that. And that's because the effectiveness of vaccines has worked. Because why? We got so many of the kids vaccinated to that herd immunity that when they're in their schools, if they're in their daycare centers, they're not getting sick from those diseases.
Thank you, Dr. Emmergleck. Really
Yeah.
simplify the message in a way that I think most folks can understand. But I do want to take this moment, Sarita, just to stress once again that for as important as the message is, I cannot stress enough how important the messenger is. We have to be put before young people trusted messengers, either in those very few trusted adults that are out there, but peers who look like them and talk like them in the same channels that they speak through, put them in front of them. Because no matter how hard or how simple or how fast changing the information is, it's much more well received when it's coming from someone you trust. And I think Jeff began to speak on this, that we have an opportunity now to react to our current situation by relying upon trusted messengers. But if we think long-term, we have an opportunity to prevent future outbreaks by working on healthy relationships, on creating spaces and environments in which youth have more trusted adults that they will listen to, no matter how complicated or simple the message is. We can change in the long term how we respond to outbreaks like COVID-19. I think if we want to think long term also as well, preventative care, we can look at building critical awareness of our youth. They are bombarded by false, real, and overwhelming amounts of information in media constantly, from the moment they wake up to the moment they turn their phone off and go to sleep. So if we can work with our young people, and I say that if you're someone who works with young people, you've done your job well if in the end of time, at the end of it, you instill a sense of critical awareness in the young people you serve. A critical awareness that allows them to analyze information for its accuracy, its worth, and filters that information through the lens of history and society, so that that one individual can make a decision on how it applies to their life and then impact all the youth around them. So the message is critically important. It has to be medically accurate, but the messenger has to be trusted. And we have to empower young people to be those messengers when there's not enough of us trusted adults around.
Jeff, there he goes, dropping the mic again.
Mike, you're a tough act to follow, man. I'm gonna have to start jumping in ahead of you. I don't look bad when I have to come behind you. No, I agree with so much of what Michael just shared. I'll just add to make sure that folks connect with trusted voices and credible messengers. Again, information has a different meaning coming from someone you have a relationship with or you have a degree of trust with. I think that's how we change or build a common understanding that can lead to change. For folks who are working with young people, I really challenge you to look at life through their lens and try not to be judgmental or impose your experience on them, because what may have worked for you may not be appropriate or may not work for them. So that's something that we have to unlearn as adults, because adultism is a thing. And in this case, it can really get in the way of us taking positive steps forward and empowering our young people to be the leaders that they're capable of. And then staying current with science. You know, I know that's a challenge because science changes, like Dr. Emmergleck said, but we really have to try our best. And I would say in doing that, to find a trusted voice in the science space. I have a couple of friends that are physicians that I text and call all the time when I have questions. They're probably tired of me after this last year. But again, for me, being able to speak to someone who's well-versed in the science gives me a different level of comfort so that I can make the best and most informed decisions possible.
Black Cross and Alive in Color have been mapping vaccine hesitancy. And so they've created these personas, and I thought it was really cool. It's different ways of looking at people and their thinking around being vaccinated. So there was the educated skeptics. And so these people aren't really against vaccines. They are, these people need to know that it's the virus that's new, not necessarily the technology. And so, like you were just saying, it's matching the message and the messenger to the specific group. And then we have the doubtful deliberators. And Jeff, you were talking a lot about how people get caught in the spiral, right? So because of the virus, they have to work more hours. And it's harder to get time off. If you were gonna get time off to go get a vaccine. And then they're concerned about, well, what if after I get the vaccine, I don't feel good? Now I need more time off. So like, it just becomes something that they doubt, they're not sure about, and so they put to the side. Then the next persona was the disaffected and distrustful. And that's the group that's really the hardest to help. Most of them are in the wait and see or not at all category. And to reach these people, we really have to show that we value their opinion. We need to validate their concerns and then help them get educated about the science. Anybody seeing one kind of persona more than another in your specific area?
It's the educated skeptic. I spoke briefly about this, but our youth are, to a degree, already critically aware because they have to be, because they are inundated with information. And if they weren't able to sift through the mouths of that, they would become numb. They would be aimless. So, and on some degree, they're already able to question everything that comes before them. But as I said before, we can do a better job at equipping them with the media literacy to really make sense and apply what is true. But for the most part, the group that we work with, they're the educated skeptics.
Panelists, I cannot thank you enough for your wisdom and your encouragement and helping us, realize that both the message and the messenger are critical elements here when we talk about moving the needle, keeping our communities safe. Hopefully that this conversation will be able to reach, not just partner organizations, but the youth themselves and galvanize them to help each other. I cannot thank you enough for being here with us. I don't want to ask one last time for questions from the audience. Ms. Corbett, is there anybody that you need to recognize?
Sarita, there is actually a question before Jessica. I'm sorry, Jessica, I just saw that you, if you want to, okay. There is a question from the audience. What can local governments do to develop trust in the communities they serve? So as mentioned, conversations like this one, Fulton County is putting together. But if you want to expand on that, Jessica.
Thank you, Andrea. I think that this, I've learned a lot tonight from our panelists, and I've tried to absorb, as you just said, Sarita, the wisdom, that we've heard from those on the panel. Again, I am both a mother and also a person who's working and doing this work now. And as a mother of teens, I agree that the skepticism, the kind of concern that people have about, that young people have about our government, that they have about the state of the world today is very real. And we're asking the community to place a lot of faith in us as a government and as community leaders, all of you are. So it is it's a daunting challenge. It's one that we cannot do alone. It's one where we are relying on, as Jeff, Michael, and others said, on trusted voices, on the people who have relationships existing. If we didn't have the relationship already, we can't start it today and expect that a person will get vaccinated tomorrow. That's not a fair request of most people. So we have to rely on our trusted voices to help us really spread that message of community health. And so I've learned a lot tonight, and I think others have as well who are listening. I just want to acknowledge several of our colleagues from our team are on the call, from our public health team, from emergency management, and of course from our team here in external affairs. So thank you. Really just huge thanks to everyone for the participation and support.
We are definitely smarter all together. And audience, you are a critical part of that knowledge base. So we have one more poll for you. We have the last audience poll. So when it comes to those personas that we just talked about, what do you see most? As a parent yourself, how do you feel? What are people saying around you? Are they the educated skeptics that Dr. Armstrong mentioned? Are they the doubtful deliberators still in that wait and see boat? Are they are weighing the time cost benefit analysis? Or are they, kind of on the no side of the fence, the disaffected and distrustful?
And Sarita, while the audience answers the poll, there is one more question from the audience. How do
Okay.
we move the needle? What 3 specific things can be done? So we can open the door, the panel for anyone to answer that.
Well, I think in summary, one of the things that I heard overwhelmingly was to have the correct information, the messaging, having the correct message about the vaccine itself, about the technology, about its effectiveness. And then, of course, the messenger, having a trusted adult, having a peer. It doesn't matter if I have all the right information in the world, if I don't trust its source, right? So those 2 things were overwhelming. And then that third one was just having the conversations in our communities. All too often, we just don't talk about it. But we never know where people stand. And so just having the conversation itself can move the needle on making our communities safer and vaccinated. Wait and see again. Wow.
I would, Sarita, I would really love to hear from the other panelists about their thoughts on that call to action question, because I've already learned so much from them. I'd love to hear.
Yeah, I think that, there's a great opportunity to work with those community-based agencies, those, the neighborhood associations, the neighborhood planning units. And I think oftentimes we come to them after we've already kind of developed something and we want to get their buy-in or get their feedback. But I think the more that we're able to include them in the planning process and to include them in the development of messaging, it's critical, because I think sometimes there is so much knowledge about what's best for our community, and this is our community. There's a certain level of protectiveness over it as well. And so I think that, being able to engage them, engage community members into the initial development process is key, and not coming to them after the fact for feedback. Surveys are nice, but a lot of communities have been surveyed to death. We come and we want to get their feedback, but they're not involved in the development. And I think that that's where I feel like you start to build trust, when you're really doing that community-based participatory research and action where they're involved from the beginning.
And I'll just add to that, Georgia Seal, which is we're one of 11 states across the U.S. does that with partnering with hundreds, I would say, community-based organizations across the state, so that we can get that messaging. How do we network with one another through these collaborations that are large and small, and then getting into the communities themselves, led by the community members, to present a consistent messaging in the framework that is receptive to that community. And I think that's important. And I'm, grateful for all the people I've met through Georgia Seal, which is, actually it's headed for Georgia Seal. It's actually headed by our Dean of Community Engagement, Dr. Tabia Akintobi. And we meet weekly. We are also part of the national effort on this conversation, because it's not just in Georgia, it's everywhere. We have to figure out who the community-based organizations are, who are the people that we can partner with to deliver that consistent messaging by the messenger who is from that community.
And I think that there's, like you said, and I'm on Georgia Still, and I think we're doing a great job of engaging those community agencies. And I think that we talk about incentives for getting vaccinated, but I think that there's also, the benefit of being able to pay community members for advocacy. You know, some people, of course, there's going to be, you know, it's going to be more intrinsic and they're going to want to do it, you know, on their own. But I think that there's a lot to be said about how you value somebody by being able to, you know, compensate them, you know, pay someone a stipend for being on the ground, being boots on the ground, going door to door, or holding forums and town halls and things like that. You know, I think that that is a way of building trust and showing people that you value them and value their time. And so I think that there's an opportunity to consider, you know, stipends or some type of incentive for people that are really, you know, stand up to be advocates and champions for change.
And I just, wow, Aisha, that's it. I mean, I think it's rooted in doing things with people, not to people. That's very important. Again, it plays into the trusting and definitely valuing people's time. You know, as Aisha said, a lot of our communities have been surveyed to death, and folks take that intellectual capital and make money off of it and make decisions for communities, not with communities. So we need to change that practice. So I just challenge people to find innovative ways to get folks active in this change process. And just to throw one out, you know, we've had an opportunity to partner with Rep Georgia to host some text banking activities for our young folks. So we're using the strength of our young people and leveraging social media to amplify the message that pushes this, you know, this drive to get people vaccinated, or at least to consider, you know, taking that step. So yeah, definitely honor people's time and be respectful.
Any other ideas to add?
Nothing that has not already been spoken. Now we just got to do it.
Right? The hard part. Again, I am made better by this conversation. I have been enlightened, and now my mind is working on ways that we can, as someone who considers herself a trusted adult, who has relationships with parents and young people, ways to move the needle, ways to not only improve the health of the community, but to help young people to see their role, to find their place. Like we talked, you know, they get so much information that sometimes they're lost. But this is a clear way that they can really have a large impact. Audience, I would love to know if you have any more questions before we leave you. It has been a valuable evening, and your input is invaluable. Like Jeff said, we want to do things together, not in separate silos.
We're very conscious about time, so we want to respect everyone's, and this has been an amazing conversation. As usual with the town halls that we conduct with Fulton County, there are videos that will be shared. There are conversations guides that are going to be available via aliveandincolor.com. So we invite you to register so you can receive follow-up information. And Sarita and Jessica, if you guys have any closing remarks, this will be the time.
Thank you very much, Gail. Again, thanks to all the panelists. What I heard tonight is there's work to be done, and that it's that there's a lot of authentic conversation and groundwork that needs to happen. Again, as a government, we cannot do this alone. We are relying on partners and relying on old relationships and trying to build new ones in the midst of this. So I just want to thank everyone again for the thoughtful responses and for all of the emails and phone calls yet to come. But thank you again. Happy Juneteenth, and wishing everyone a wonderful weekend.
I just echo Jessica's comments. You came, you showed up, you conversed, and our collective minds have been much better than the sum of its parts. So thank you, thank you, thank you.
Thank you.
Thank you, everyone. This has been wonderful.
Thank you. Thoroughly enjoyed it.